Good morning, everyone. I want to start by thanking the National Academies and the Workshop Planning Committee for bringing together such a stellar group of researchers this morning to discuss strategies to limit SSB consumption among young children. I also want to thank the California Endowment and the Chobani Foundation for co-funding this workshop with the Robert Wood Johnson Foundation on an issue that we feel is critically important to the health of our nation's children. RWJF has a vision for a nation that... How do I advance? Oh, there we go. RWJF has a vision for a nation that lives by a culture of health in which everyone in our diverse society has the opportunity to lead healthy lives now and for generations to come. One of the key thematic areas within RWJF is healthy children, healthy weight. And our work in this area is driven by two overarching principles: that all children need nurturing environments to grow up healthy. And because children are nested within families, all families should have the opportunity to provide those nurturing environments for their children. We believe that to achieve a culture of health, all children and their families must have an equal opportunity to attain optimal physical, social, and emotional development and well-being. And we know that so much of the critical physical, mental, emotional, social, and cognitive development that takes place during childhood long before any of us ever walk through kindergarten doors. From our earliest years, nutritious foods, active play, and positive social and emotional environments are critical to our health and well-being. Unfortunately, as many of you know, many children across our nation lack some or all of these basic necessities, which affect their health at every stage of life. For those reasons, promoting healthy development during early childhood, as well as health equity, are major priorities for the Foundation. RWJF funded this workshop because evidence has shown that excessive consumption of sugary drinks can contribute to health problems like unhealthy weight gain, diabetes, and dental caries, and I'm sure you'll hear much more about that in the first few presentations. We think that the SSB consumption among our youngest children is too high. Despite declines in recent years, we've seen that by age 2, more than 1 in 3 children have consumed an SSB on any given day. And children ages 2 to 5 still consume an average of nearly 100 calories every day from sugary drinks. We also know that disparities persist. SSB consumption is higher among Black youth and youth from lower income families. And on the flip side, we also feel that water, if it's coming from a safe source, is the healthiest beverage option for children. So we see increasing water consumption as a potential lever for reducing consumption of unhealthy drinks like sugary beverages. As all of you know, young children spend much of their waking hours with adults, including parents, daycare providers, and teachers, all of whom play a crucial role in creating healthy environments and fostering healthy habits. And our work over the next few years will focus on supporting policies that have the potential to impact the overall health and well-being of kids through the settings where kids spend the bulk of their time, within families, early care settings, and schools. And the Foundation hopes that this workshop will help guide our work in identifying policy opportunities to limit SSB consumption and/or increase water consumption, safe water consumption, among children aged 5 and under, particularly within the populations at greatest risk of poor health outcomes. And I'd like to conclude my remarks just by thanking all of you for joining us either in person or virtually over the next day and a half. Clearly, this is an important topic for many people given the turnout that we've seen, both in terms of the in-person attendance as well as the virtual registrations. And we hope that you get as much out of this workshop as we anticipate we will.
Good morning, everyone. This is Judi Larsen from the California Endowment. Can you hear me?
Hi, Judi. We can hear you.
Okay, great. Thank you. I didn't want to be talking to myself. So thank you so much, everyone, for the opportunity to share some opening remarks and very eager to hear about all of the great research findings. For those of you not familiar with the California Endowment, we are a statewide health foundation based in California, and we are on a 10-year journey to help support a range of leaders to build healthier communities. Our priorities include very strong application of a racial equity and prevention framework. We believe that when we're looking at addressing issues like limiting access to sugary drinks, that we need to support a range of grassroots organization, system, and health leaders toward collective action versus individual silos of work. We've been working in this area for over about 2 decades, and we're looking at a range of strategies, so limiting access to sugary drinks, really being deliberate and intentional about making sure that water is readily available and free through our All for All campaign, and looking at the retail environment in terms of how do we look at healthy food and beverage offerings in underinvested, low-income communities across the state. Some of the other work that we've done and we believe that really helps move the agenda, move policies and practices is really strong messaging, communications, and combined and collective efforts to really say we want more access to water, less access to sugary drinks. We have a long history in California to support and promote healthy beverages that date back to 1995, where we started working on fluoridation of public water systems. And we're very proud of local leaders in Berkeley, Albany, Oakland, and San Francisco who have passed soda taxes as a way to really show that they want healthier options for their communities. Some reflections from this work have been in terms of really looking beyond just program and intervention effectiveness without understanding the community context of it's easy to say you should drink less soda, but if the water is contaminated with nitrate or arsenic, it's really hard for community members to really follow through with those recommendations. We feel really strongly that a more explicit focus on racial equity really creates more local ownership and pressure from local communities and leaders to change policies, practices, and their environment to ensure implementation, not just the policy win. And we're really, looking for stronger alignment between efforts to improve access to water and sugary drinks. I think for so long, some of those efforts haven't been as concentrated as they could be, and we're really excited about hearing more from both the different presenters today about how we can be stronger together to support those efforts. We at the California Endowment believe that fundamentally, in order to build healthy communities, we have to have access to free potable water and less access to sugary drinks. So we're really excited to be a sponsor of this workshop in partnership with Chobani Foundation, Robert Wood Johnson, and thank you so much to the National Academy of Sciences for sponsoring this workshop.
Good morning. I am so glad to be here representing the Chobani Foundation. We're really excited for the opportunity to sponsor this really well-planned workshop alongside the Robert Wood Johnson Foundation and the California Endowment. We share some of, and in fact many of the same ideals. The concerning trends for diet-related illnesses and the desperate need for better food choices, particularly for children in the U.S., are embedded in the reasons the Chobani Foundation exists. Since our earliest days, the Chobani Foundation has proudly supported our hometowns in New York and Idaho and a lot of other communities in between. We support programs to empower healthier food choices, promote health and wellness education, make better foods accessible, and promote sports and fitness. We invest in our communities, developing meaningful relationships with families and neighbors in the communities that surround our operations. And this includes advocating for better transparency to help improve food and beverages choices. Now, from the agenda, it's clear there are many pieces of the puzzle to assess policies and programs to limit sugary beverages. In our communities, we know families want to do the right thing for their young children, and they want to be empowered to do the best when it comes to their children's health. They want partners who work with them. And when it comes to sugar-sweetened beverages, they want to know all the options for replacing the empty calories they provide. And that means nutrient-dense beverages and foods and water, and to know how they relate to the healthy benefits of eating patterns and exercise, and that's what matters. And we know this from our relationship with Chenango County, New York, for example, which has about 13,000 families and has the highest obesity rate, about 40%, among New York's 62 counties. As serious as the Foundation's efforts are here, we have to be pragmatists. If we were to approach the Chenango County Chamber of Commerce, the Board of Supervisors, the schools, and local policymakers and families with just water as a replacement option, we're not sure we'd get complete change. The programs and policies have to be pragmatic and actionable, so we hope this day and a half will find evidence of this approach and really great discussions that addresses some important questions. Evaluating the policies and programs to limit sugar-sweetened beverages has to start from the facts. American diets are far from ideal. I think everyone in this room and watching knows that. And all age groups, including children after the age 3, fall short of intakes of key food groups and nutrients. And so one element of importance is understanding what changes occur during this critical time that will help raise awareness about the need to reduce the intakes of sugary drinks or sugary beverages by young children. And so a question is if programs have adjusted intakes to replace nutrient-deficient calories with nutrient-dense calories. And another insight we hope will be addressed, another important question, is whether there are programs and policies that explore or even incentivize innovation and renovation to create more nutrient-dense beverages in the food sector to meet the needs. Now, replacing sugary sweetened beverages with milk or water is inversely associated with the development of obesity among children. And the important point about shifts is that they require that individuals replace less healthy choices. And the extent that how-tos and simple shifts, such as those shown here, are used in marketing programs aimed at the target age is of interest. And these simple shifts or replacements can improve dietary quality and may be easier to stick to over the long period of time, as opposed to banning or excluding certain foods from the diet. And we hope to learn more on this perspective as we follow the discussion in this day and a half. And theory provides a good basis for thinking about what drives behavior, especially among young children. And what's needed is the evidence that works within real-world settings. Identifying evidence-based strategies among the programs and policies that support simple shifts among children and their communities is important. And what we hope emerges from this workshop is insights of successful strategies that target the triggers of behavior, which provide the why-to and the how-to information about a given behavior, versus just focusing, for example, on punitive measures such as taxes. And we think it's also important to recognize that the concept of nutrient density to fill the gap for sugar-sweetened beverages has been included in many studies of nutrition education approaches, such as those that are listed here. And this approach has also been considered in programs to change the food environment. And so finally, the final point and an area we are interested in the insights that emerge today and tomorrow is in order to understand the reducing or the effects of reducing, limiting, or replacing sugary beverages from children's diets, behavior in the context of a whole dietary pattern has to be considered. So the Foundation is looking forward to learning if policies and programs aimed at limiting sugary beverages have considered that this is just one behavior in the context of overall eating patterns. And so I'm looking forward to the program. Thanks again from the Foundation for this next day and a half. Thank you.